Let's talk about a symptom of left sacroiliac joint pain. You ever hear somebody say, oh, I feel like my left sacroiliac joint, it's locking up on me, especially when I put weight on that side, on the left leg? Well, they could get it treated, get some soft tissue work, maybe a little soft tissue work on the psoas, the QL, the gluteals, whatever, the lower back, or they might get it adjusted by a chiropractor or a therapist. Spinal manipulation or joint manipulation might feel better, but it always somewhere down the line comes back. So you ever consider the possibility that it might be the way the person has a tendency of moving that might be driving why they're feeling those symptoms of their left SI joint being locked up? And one of the things I've noticed, I just saw a client today who has that exact symptom, was her relationship with space on the left side, her left peripheral vision, her just her awareness of space on the left side of her world, let's say. So understand that I think it was 70 to 80% of our brain, of our cortex, cerebral cortex, is devoted to visual and auditory processes. That's a large function of our brain that deals with those sensory of visual and auditory functions, right? So that's if we access them, if we use it, if we're aware of it. And anything with our bodies is use it or lose it. If we don't use it, it just doesn't become useful anymore. So we put it aside and we lose that function. So here's the thing: when somebody's every time they walk and step forward and they land on that left leg, if they're not too aware of the space on the left side of their body in relationship to them, if they don't see movement of the world on their left side with respect to their body, what do you think your body's going to do? It's going to try to fill up that void with tension, with stress, with locked up joints. It's going to try to get off that side as soon as possible and go to the other side or wherever it feels more safe. So in this case, she could not perceive, as she took a step forward with her left foot, objects on the left side of the space around her moving with respect to her. So of course, she's always going to have this limitation of her left side of her body tightening up. And any type of stretch, massage, or exercise, or meditation, or breathing techniques, it may calm it down, but it's contributing to her limited stress management strategies. And that's the key, is to understand what are a person's stress management strategies and how limited they are, and in what ways can we actually add to them to give them a more expansive adaptive capacity to manage stress. So one of them is just to be aware of the visual spatial properties or functions that the brain has. And if we don't access that, we're always going to have limitations to our musculoskeletal treatments.